If you guys are in the mood for a tricky MMI practice scenario, I have the perfect thing for you. So in this case, you'll be the doctor. So you are the doctor. And your patient is a 12-year-old boy. And the third party involved is going to be the parents of this boy. Now, automatically, when we see that there's a minor involved, or we see that there's somebody who we're not sure if they can make their own decisions, you start to get a little bit nervous, right? Because you want to make sure that you answer according to what the true rules are, right? The true rules that, a doctor would follow in this case. So when you see an instance like this, don't worry about that, right? You're going to try to use the procedure I'm going to show in this video, and it's going to allow you to make the correct decision. And we saw this with some of the past MMI practice scenarios I've uploaded over the past few weeks. So you can see some type of consistency with how I go about solving these problems. So we have a 12-year-old boy, and he is terminally ill. So he has a terminal illness. And when you see him, he asks you what the prognosis is. Probably not using the word prognosis, but he asks you what's going on. So, naturally you could just go about telling him what's going on in a way that he can understand. However, the parents had previously asked you if there was bad news, don't tell him. Or, they know what the bad news is, but please don't tell him. What do you do in this case? Do you listen to the parents' request for not telling him? Or do you need to tell the boy? Or do you do something else? So it's a little bit of a tricky situation, right? What do you do in this case? Now, this can be presented in one of two ways. It could be a discussion scenario, or it could be a role-playing scenario. So in the case of the discussion scenario, it's going to be you and the interviewer in a room just discussing. And in the case of role-playing, you would have yourself and you'd be talking to two parents, right? You're probably not going to have the 12-year-old boy or somebody trying to play the role of the 12-year-old boy just because it would be a little weird. You'll have the parents and yourself. So you can actually be telling the parents what you're going to do regarding what they want and what the child wants. So the child wants to know what's going on. So it can be presented in either of the two ways. And the only difference is really going to be whether, or the ways you ask your questions, right? The way we collect information. Because if you're in a discussion scenario, you have the liberty of, asking questions that you'd want to know, even if you're just asking them out loud, or there might not be something you can figure out. It's going to be information that you want to know before you can make a decision. However, when you're in the role-playing scenario, you can't really do that because you're going to look like a psychopath. You need to actually go ahead and ask them questions. So you got to, tailor your information collecting process just a little bit, but it's going to be fine either way. So let's go ahead and take a look, right? What is the problem, right? Before we actually go ahead and get into collecting information, what is the problem we're dealing with? Terminally ill minor asks about prognosis. Parents don't want him to know, or don't want you to tell him. So we think this in our mind, right? That's what the problem is over here. So we can go ahead and collect some information. Well, the first question, probably the most basic one over here is, why don't the parents want him to know? And you'll likely be hit back with something along the lines of, that humans, if they find out that they, no, I shouldn't say humans, that's terrible. Adults is what I wanted to say. When adults find out that they have a terminal illness, say they find out they have a few months to live, they'll be sad, they'll be nervous, but then eventually they may come to terms with it and they'll be able to live out the last remaining days, weeks, months, years of their life to the fullest, right? They can go skydiving, they can travel the world, whatever they want to do, they'll make sure they did it. Now, when you're dealing with a 12-year-old, right, would they be too sad and too scared and too nervous to actually enjoy those last few months? So maybe the angle of the parents is that they don't want to tell him so that he can still make sure he enjoys the last few months of his life. However, they want to make sure he's not scared during that time. That could be what their angle is, but you want to find out just to hear what their angle is going to be. They're likely not going to be cruel people who just don't want their kid to know what's going on. They're going to have a motive behind it. Next, you'd go ahead and ask how long the kid has to live, or you'd figure out how long. I'm assessing this based on a discussions standpoint because I think that's going to be the most common way this problem would be presented. So I'm assuming, how long would he have to live? I'm not going to ask the parents how long he had to live because I should know that because I'm the doctor in this case and they aren't. So don't ask that question. It's just discussion based. So how long does he have? Here's a good question that can be asked in the discussion or the role-playing scenario. What do you being directed at the physicians, you think his reaction would be? This is going to be building off of the first question, right? The one where there's going to be a reason why they don't want him to know, and it's probably going to be based on this third question over here, which is it's kind of piggybacking on it because, what do you think his reaction is going to be, right? They're the ones who know him, so if it's just that, maybe they're too scared of telling him, maybe he's a mature kid who understands these things and he'll be fine, right? You don't really know. You're not in a position to actually make a decision yet. We're just collecting some information. So we have all this over here. Why don't they want him to know? How long does he have to live? What do you think his reaction would be? And if anything, how much does he already know? There we go. So 4 questions there. I think those are 4 pretty good questions, so we can move on. Now the part where we restate the problem, right? So what exactly is the official problem that you're going to, before you go out and say which solutions you can do or the solution pathways, we go ahead and just restate the problem, right? So, what is the deal here, right? I need to decide between telling my patient the truth, because the child is the patient in this case, and respecting the wishes of the parents. Because these two things cannot coincide. Or can they? So in a case like this, right, when we're dealing with a situation like this, the best way to go about it is we know we're going to have our extremes and we're going to have something in the middle, right? So let's go ahead and look at our solutions, right? If you're kind of confused about where this is going to go, let's just go ahead and open up our possible solutions. Then we'll go one by one and cross them out or take them depending on if they're good or not. So the solutions. Number 1, tell the kid right away. He asks you what the prognosis is. You tell him exactly what's going on. Well, that's one extreme. The other extreme is don't tell the kid. And respect the wishes of the parents. Well, we have problems with both of these, right? You might think that these are the only 2 solutions in this case, but, as we've seen, there's always a way to have something in the middle, and, both of these have problems with it. So I would not feel confident going with either of these pathways. I want something that's going to take a little bit of both of these. Now, what is the main issue at stake here, right? Why don't we just go ahead and tell the kid, right? The reason is we don't know if the kid will be able to understand what's going on. If the kid was able to understand what was going on, that makes it an entirely different situation. If he is mature enough to understand, about his disease and he can grasp what's going on, then, there's no reason why you need to respect the wishes of the parents. The kid should know what's going on. It's his own health. But we're dealing with a 12-year-old here, right? Everybody is at a different stage in their awareness or their mental development when they're 12. Some people might be more mature than others. You know that there's a huge range if you've ever worked with young kids or if you were a young kid yourself. probably are if you're watching this video, at least at some point in your life. So you know that there's going to be 12-year-olds who are mature and understanding, and there'll be 12-year-olds who just simply live in a fantasy world. So you want to figure out which type of 12-year-old this kid is going to be, and that's going to be your middle ground over here, which is assess the capacity of the child. You want to see how much this kid understands. If you can deem that this kid is, we're going to talk about what questions we'd ask the kid in a moment. If we can see that this kid is mature enough to handle this type of news, he's mature enough to appreciate and understand this type of news, then that's a completely different story. That's when we're going to go ahead and side with the kid. And if we rule that he is not in the form of mind that he would not be able to appreciate it, we would rule in the favor of the parents. Now, what are the problems with the two extremes before we move on, right? So what is the problem with telling the kid right away? Well, the problem with this is, you're not respecting the wishes of the parents. Which should, let's go ahead, be respected if the patient was incapable, right, of not able to understand. So if we just go ahead and side with this extreme, well, we remove the chance that, we can have maybe a 50% chance of making the right decision. We don't know if this kid is going to be, able to understand or not. And if you just don't tell the kid, you're not being honest with your patient. You're simply not being honest with your patient, right? Just because he's 12 years old doesn't mean he should have much different treatment, right? You do have the opportunity to assess whether or not he is capable, and if he is not capable, then there's nothing wrong with allowing the parents to make the decisions regarding his health. But if the kid is understanding and able to appreciate the news, that's really what we're looking at. Is he able to appreciate what we would tell him? If we find out that he is, then he should know what's going on. So we take the middle ground, right? We take the middle ground. We're going to assess the capacity of the child. Let's go down here and figure out which questions we would ask. So what do you want to do here? Will he appreciate the prognosis? When I say appreciate, I don't mean, he's not going to be thankful for this. Obviously, he's not going to be thankful to find out he has a terminal illness, but will he appreciate the severity of the prognosis? Does he understand what having a few months to live means, right? Does he know what that is? So you ask this kid a series of questions, right? So let's think of some things we would ask him. This is the part where we actually determine what we're going to do. We've already decided what we're going to do, but we're going to make the specific plan of action. So we're going to question the kid. We're going to ask the patient questions. To assess his capacity. Okay, we're going to ask him questions to assess his capacity. So what are some questions we can ask him, right? Let's think of some things right now. What do you know about your illness? Now, this is, two ways to go about this question, right? If the kid already knows that he has an illness, maybe he's had a history of, being in hospitals for a lot of his life, and this is like the final stage. So he may have an idea of what his illness is. If this is the first time that you're finding out about this illness, you can ask him, what does he know about whatever this is, right? So whatever illness he has, you can ask him if he knows anything about it by default to start off. So ask him what he knows, right? Let's hear what he has to say. Maybe he is knowledgeable of what's going on. If he has been suffering from whatever illness he has that is terminally ill, likely something he's been suffering for at least more than the time he's just been here. If we're dealing with a 12-year-old boy, find out what he knows. Maybe he already knows that it's an illness that leads to death eventually, right? If he understands that eventually he's going to die from this disease, well, finding out that time is going to be within a few years or a few months, he might be able to understand that and he'll be fine with it because he already understands what's going on. So what do you know about your illness? That's really the main question we want to ask here, right? You can pretty much assess his capacity based on that one question. What do you know about your illness, or what do you know about whatever your specific illness is? You can actually go ahead and substitute your illness in for the actual name of the illness. Also another option available. Any other questions we can ask this kid, right, to understand what he knows? What do you know about your illness, right? I guess that's the main question we can ask, right? I think if we just ask that question, we will be assessing his capacity, right? Because depending on how he answers that, that's going to, if you want to ask more specifics, right? I guess for next questions, right? Let's go ahead and get a different font color because the one I have is disgusting. 2, 3, and so on. All these other questions here are going to be specifics, right? So getting into specifics about his disease. I don't really need to go ahead and give some examples here. I think that we pretty much know what we would ask here. Right, so if he has a disease that is, if he has cancer, for example, right, what do you know about cancer? What do you know about the cancer disease? What do you know about treatments? All those things you would ask down here. I guess it varies based on which disease, so I'm not going to get into details. But that's the type of questions. And really with all these questions, you're going to see, will he appreciate the prognosis? Will he appreciate that he only has a few months to live? Will he be able to enjoy, or whatever the parents had asked for, the reason why, where was we collecting information? Right here, the reason why they didn't want him to know, right? Is he going to still be fine with that if he knows about this disease, right? Find out, what would happen if he only had, obviously if you ask a question like that, he's going to catch on, right? 12-year-olds are not stupid. If you only had a few months to live, what would you do, right? Would he be able to still enjoy them? And that's really what the parents' main goal is here. They don't want to just keep information from him. They want to make sure he enjoys the last few months of his life. So will he still be able to enjoy that with the news? It's up to you to figure out. So in the case that, you do think that he will appreciate the prognosis, remember what I meant by appreciate, yes. And we have no. In this case, side with the parents. In this case, side with the patient. And that is how I would go about solving this scenario. So we saw how we went through the pipeline, right? Well, it seemed like a really difficult scenario. We actually managed to find a middle ground right down the middle, which allowed us to have, the best of both pathways, right? Now, obviously, this middle ground, this pathway we have over here in the center, it will eventually lead to one of the extremes, but it's the method that you get to the extreme, right? So while, you're still going to end up either telling the kid or not telling the kid, because there's really no middle ground to doing that, you still want to, monitor the way that you actually get to one of those pathways and assessing the capacity of the child, understanding whether or not he will appreciate the news he's receiving, will be the best way to do that. And it's going to be the correct way about going about these scenarios when you're dealing with someone who may or may not, or I guess the best way to put it is if you're dealing with one party who wants to do something else and one party who does not. So in this case, the boy wants to know what's going on and the parents do not want you to tell him. So that's what I would do. Other situations when you have a minor in this case, you can be dealing with a patient who has a mental illness. We saw that in the past as well in this series. You can be dealing with an elderly patient who suffers from Alzheimer's. All these things that are available, all these possibilities. So you can just adapt them based on that. This is the pathway we're going to take. Hope you enjoyed this video. Went on a little bit longer than I wanted, but I think I got all the information in that I wanted to break down. If you have any questions about this case, leave a comment below and I'll respond to you as soon as possible. And I'll see you guys in the next video.